See that okay?
Yeah, I'll just translate very, very quickly. Mørke personligheder og inducerede vrangforestillinger. Del 1. Løsningen er det gordiske knude på konflikten i familieretshusene og i familieretssag eller psykisk voldsretssager. Det var det cirka. All right, that was about it. Go, take it away.
Okay, so what we're going to be covering today is what we have ended up calling the Darks and Delusions series of papers. Part 1, which is what we're going to cover first, is just basically an overview of the relevant theories and the concepts, both psychological and legal, that affect this situation primarily in families. Then the next paper will take a deeper dive into the personality disorders and the delusional disorder part of it. The third paper will be presenting the results of an archival data study that we did on the associated clinical signs that Dr. Childress has identified. And then we do have a part 4 that's already in progress, and that'll be information about early childhood attachment disruptions and how that predisposes people to developing trauma origin delusional disorders later in life. And we plan to include some common themes of what these non-bizarre encapsulated delusions look like in high conflict family and domestic violence court cases. So what is a high conflict family court case? They comprise about 10% of all family court cases, and that holds true pretty much worldwide. They are essentially prolonged, complex, and intractable litigation. It can last even up to almost 2 decades, depending on how old the children are when the litigation starts. But it's really just a form of post-separation coercive control, and it involves the weaponization of the legal system, child protective services, law enforcement, the children's education system, medical and mental health providers, the family social networks, and even the children themselves. So an overview of attachment theory is that children are inherently driven by their survival instinct for attachment to emotionally bond with caregivers for their protection and nurturance. Attachment begins in infancy and continues developing throughout adolescence. Healthy parenting will create what's called a secure attachment style. Problematic parenting creates one of 3 insecure attachment styles. So they are typically referred to as anxious avoidant, anxious ambivalent, or disorganized. What results in those 4 different types of attachment are what's been categorized as parenting styles. And there are 4 of those. There's authoritative, authoritarian, permissive, and neglectful. And each of these 4 styles are distinguished by varying degrees of the caregiver's warmth, sometimes referred to as responsiveness, control or demandingness, and autonomy granting. Normal range good enough parenting is imperfect. It reflects the parent's cultural and religious and personal values while incorporating clear structure and appropriate expectations, flexible dialogue, and negotiation with the child. So while some parents might be more structured and rule-driven and others are more permissive, there's a range of good enough. So when a child starts rejecting a caregiver, especially a parent, at any developmental stage, that indicates a severe attachment pathology. The attachment styles. So a secure attachment style, what you'll see in a child is that the child will use the caregiver as a secure base while going out and exploring the world and then returning if they become frightened or they need reassurance. And if that caregiver leaves the situation, the child will be initially very distressed, but will be very happy when the caregiver returns. An anxious and avoidant style, what that looks like is that the children will show very little, if any, distress when the caregiver leaves, and they will avoid the caregiver when the caregiver returns. They're also very low demand on the caregiver, and they present minimal protest behaviors when they're distressed. An anxious ambivalent style, on the other hand, would be a child who is extremely distressed when a caregiver leaves. and then shows inconsistent behaviors when the caregiver returns. So for example, the child might initially be happy when the caregiver returns, but then become resistant or angry if the caregiver tries to hold them. And then the disorganized style, this is very typical of children who have been legitimately abused or neglected or subjected just to even severely inconsistent parenting practices. These children have no organized strategy to bond with their caregiver, and they'll seem disoriented or confused when the caregiver is present. And that's because the caregiver's conflicting behaviors are both a source of comfort and fear. So the child is never really sure how to behave and is constantly trying to read that caregiver to see what they should do, if it's a safe moment or not a safe moment. So family systems theory. Family systems talks about many things about how families work, but really what's most important to this particular dynamic is understanding that families go through many transitions throughout life, and divorce is one of the most difficult. It requires the family to move from an intact to a separated structure. So you can see a diagram here on the bottom where you've got one complete circle with the parent and the child inside. And then divorce can be done healthy when the two parents are still united to the child through co-parenting responsibilities and obligations and rights. About 75% of all divorcing and separating families are low to no conflict. About 15% there will be some moderate conflict, and that's usually helped to get it under control with mediation, maybe co-parenting classes, perhaps a very short, relatively simple trial. But then you've got 10%, the 10% which are high conflict, and absolutely none of that helps. When there's a poor transition in the family, usually that will display through the child's behaviors. And when one family member rejects another in any kind of combination, it's known as an emotional cutoff. So the other diagram that you'll see, child are in a circle together, and then the parent is completely cut off from the other family members. So parental psychological control talks about, just in general, whenever there's a conflict between two people, very often a third person will be elicited to get involved, and that's known as triangulation. So one parent can certainly triangulate a child for support against the other parent, and they do this most often using very covert psychological control and not necessarily overt commands to the child of what to do. Anytime that there's a parent-child alliance, that's known as a perverse triangle, or it's also sometimes referred to as a cross-generational coalition. Actually, it's more often referred to as a cross-generational coalition. What this does is this puts the child into an elevated power position in the family, which is now known as an inverted hierarchy. And this puts the children in a position to judge their disempowered parents' adequacy and ultimately to participate in the divorce by also symbolically divorcing one of their parents. This is accomplished through a process that's known as enmeshment. An enmeshment is an over-involved relationship that's created by one parent's violation of the child's psychological integrity and self-autonomy. And this boundary violation represents the transgenerational transmission of attachment trauma, typically that was suffered by that allied parent when they were a child. So this is a rippling through families of distorted parenting practices. The trauma transmission is accomplished with 4 types of boundary dissolution by the allied parent. Enmeshment, which we just talked about. There's also intrusiveness, there's role reversal, and spousification. And sometimes you'll hear people refer to spousification as adultification or infantilization. They are a little bit, those 3 are a little bit different, but they're all very related. The post-separation coercive, the cross-generational coalition, and the inverted hierarchy are used as a form of intimate partner, emotional and psychological abuse, which is known as coercive control. Coercive control is a hidden and particularly insidious form of emotional and psychological intimate partner violence. And the post-separation child abuse and intimate partner violence often manifests through coercive control and weaponization of the family and the domestic violence courts and the children themselves. So I'm just going to briefly touch on the subclinical dark personalities. We'll go into that in more depth in the second paper, but just to know that subclinical dark personalities are a combination of pathological traits featuring self-centeredness, dishonesty, manipulation, callous attitudes towards others, and heightened externalizing behaviors. There's 3 particular combinations that have been identified in the literature so far, and those are the dark triad, the vulnerable dark triad, and the dark tetrad. And trauma origin delusional disorder, again, I'm just going to briefly talk about this. We're going to go into that more in depth in the second paper. But a delusion is just a fixed and false belief that persists despite conflicting evidence. Delusions can be mild, just temporary delusion-like experiences of brief and unusual thoughts and non-bizarre ideas that resolve without having to have clinical intervention, all the way to very severe, firmly held beliefs that don't go away despite how much contrary evidence there is, and it can't be explained by any other condition. These are very problematic in family and domestic violence court cases when the delusions are non-bizarre and encapsulated. And I'll go into the definitions of those a little bit more in the next paper. But trauma origin delusions are believed to be much more common than previously recognized and realized, and that's admitted in the literature. We know that they're common and they're not being detected. So virtuous victim theory is when an individual emits social signals indicating that they are highly virtuous and victimized by someone or something. It's the amoral manipulation to obtain unwarranted resources and assistance. And the virtuous victim effect, essentially, it inflates the positive perception of the supposed victim's honorable moral character and need for help. And it will increase the adverse view of and desire of others to harshly punish the alleged perpetrator. These are also highly problematic in family courts because the dark personalities are known to be very manipulative and to manipulate evidence by distortion, by omission, and by fabrication. This will also frequently come out as false abuse and neglect claims and allegations that a normal range ex-partner is unfit or psychologically unstable, and convincing denials of one's own abusive behaviors. So dangerous decisions theory, this you find more in the literature on the legal side of issues. This has been studied pretty well in like criminal cases mostly. But what the dangerous decisions theory is about is it talks about how witness credibility and trustworthiness determinations are intuitive judgments about character and truthfulness, either by a judge or by a jury. And that this assessment of the evidence that's being introduced. This process can trigger specific biases in fact finders and decision makers, and it can lead to incorrect conclusions. And it has been shown that judges' ability to detect lies is very far from accurate. So when you have a dark personality is using manipulative, virtuous victim narratives, it can lead to dangerously incorrect decisions being made for the child. Induced delusional disorder is something we're also going to go into. It's just basically where a delusional belief of a dominant primary or inducer becomes the basis for the belief of a submissive or a secondary or an inductee. The primary inducer's dominant role is established through rigidity and possessiveness, and the secondary submissive role is established through vulnerability, from being younger, from being less intelligent, passive, dependent, suggestible, and isolated. The risk factors for developing induced delusional disorder start with a strong attachment motivation towards the inducer, so parent and a child. Stressful life events affecting the relational stability, such as a divorce, and isolation, because now the parents are separated, and so the child is isolated from one parent's influence. And also from cognitive impairment, from being young age, and emotional immaturity. So it's absolutely, everything fits for the situation surrounding a divorce from a dark personality. Stimulus control. What this applies to is when a clinician is doing a diagnostic assessment to determine whether or not a parent-child conflict is authentic versus inauthentic. So in an authentic parent-child conflict, the parent's behavior changes, which is the stimulus, will affect the child's behavior and also change the child's behavior or response. So if you see that a parent's change in behavior is changing the child's behavior, then that's an authentic parent-child conflict. The child's behavior is under the stimulus control of that parent's behavior. But in an inauthentic parent-child conflict, no matter how much the parent's behavior changes, the child's behavior does not change. So the child's behavior is not under the stimulus control of that parent's behavior. So for example, whatever offered reason for the child not wanting to have a relationship with one parent, no matter what that parent does to correct the supposed problem, the child will continue to reject that parent, indicating it's not an authentic parent-child conflict. So the differential diagnosis of child abuse, it talks about how in all high conflict family court cases, a clinical assessment, not a custody evaluation, a clinical assessment for possible child abuse should be conducted. The differential diagnosis would be child abuse, but it's going to be by one parent or the other. So either it is abuse by the targeted parent, in that they were engaging or are engaging in severe neglect, physical abuse, or sexual abuse, creating the child's attachment pathology. And that would show up as an insecure attachment towards that parent. If it does not match the pattern of stimulus control, and if the child's behaviors are not displaying as an insecure attachment, then what you've got going on is abuse by the allied parent, which would be psychological abuse. And that is creating the child's attachment pathology through the form of a shared persecutory delusion and a false or factitious attachment disorder toward the other parent. And the allied parent is doing this for secondary gain of manipulating the court's decisions as to child custody and ultimately meeting their own emotional and psychological needs. So what we need is a child protection response. We need a determination of possible child abuse, which requires a high degree of competence in assessment of the pathology, accurate diagnosis, and an effective treatment plan. So the legal and mental health professionals who are involved with the family must implement a child protection response, remove the family conflict from the adversarial legal system, and direct the family conflict into a therapeutic mental health setting, and then maintain the safety for all family members through therapeutically informed court orders. So those are my references. And this is where all currently available 3 parts of the series of papers are available on ResearchGate, and there are email addresses for Dr. Childress and I.